Hello, I'm Kermit Muhammad at OAK Orthopedics in Bradley, Illinois. I'm a hand surgeon and I treat upper extremity conditions. Today I want to talk to you about carpal tunnel syndrome, some of the frequently asked questions that I have from patients. First of all, carpal tunnel is one of the most common conditions that I treat. It's really a nerve compression syndrome in the hand. The symptoms are numbness and tingling and pain in the hand. Very often people have problems at night waking up, and so this is why people come in to see me. And so there are non-operative things that we can do. We can do steroid injections, sometimes therapy, but very often we get to surgery. And by the time we get to surgery, we treat the problem, fix it, and patients are very happy. Carpal tunnel has very classic signs and symptoms. The description by the patient very often includes numbness and tingling, primarily in the thumb, index, and middle finger. There are also classic signs that can be found on physical exam. Physical findings associated with carpal tunnel syndrome occur in the radial-sided digits, which are the digits or the fingers on this side of the hand, primarily the thumb, index, and middle finger. Very often patients will complain of pain and numbness in these fingers. Also, sometimes half of the ring finger can be affected. They can describe it as burning pain. The hand is burning, it may be swollen, it may feel that they can't make a full fist, and sometimes the pain even travels up the arm. So in physical exam, one thing we can do to test this is to place compression directly on the median nerve, and very often that reproduces those symptoms of numbness and tingling. Another test is to hyperflex the wrist, and this causes compression on the median nerve, and that can also cause the same symptoms. Also, patients find when they're working maybe on a keyboard, if they have hyperextension of that wrist, it can also place a higher pressure on the median nerve in the carpal tunnel. So these findings are good physical clues to help us to localize the problem. So you've made it to carpal tunnel surgery, and we've completed the surgery, and you have questions about what to do after surgery and how your recovery will go. And so I've written down some of the questions that I commonly get from patients so I can answer them to clarify what to expect. One of the first questions that's asked of me is, how long will I have to stay off work? And that's really a variable answer. It really depends on what you do. If you're a manual laborer, it's going to take a lot longer, 4 to 6 weeks. If you're at a desk job and say you're working on a computer or paperwork, it's really kind of up to you. Some patients don't really take much time off. Some patients prefer to wait until the stitches are out, and that's about 2 weeks. So that's one of those areas where we can work with you depending on your job needs, but we can definitely get you back very quickly. One of the next questions I get very commonly is, when can I drive after surgery? For carpal tunnel, this is a very easy answer. As soon as you've recovered from surgery itself, meaning the anesthesia of that day, you can drive. It's not a very invasive surgery, so that you can use your hand. It is safe to drive. One of the next questions is, do I need someone to drive me to surgery? And that is related to driving as well, but of course the day of surgery you definitely need someone to drive you. You will have anesthesia. There are a couple different ways we can do the anesthesia. You can do sedation or twilight anesthesia or general, but whether you have lighter or heavier anesthesia, either way you definitely need a driver on the day of surgery. Another commonly asked questions by patients is this surgery going to work? And very often they say they know someone who had carpal tunnel surgery and it didn't work. And I would say that in my experience, the vast majority of these surgeries are successful to the point where it's in the very minor few that are unsuccessful. And I would say also that when you look at patients describing carpal tunnel that was unsuccessful, there's a lot more to that story. And so I would say that straightforward carpal tunnel, treated adequately with either operative or non-operative treatment, does get better. So another question I get very commonly regarding carpal tunnel is, what do you actually do during surgery? And it's actually very simple. We release or cut the ligament. Now, obviously, that ligament is there for a reason, but definitely with carpal tunnel being one of the most common surgeries that a hand surgeon will perform, it's definitely okay if that ligament is released. Basically, it's a tunnel, and we release pressure in that tunnel by cutting the ligament. We do not do anything to the nerves or tendons that go through that tunnel. One of the other questions that comes up very frequently is how much pain will I be in after surgery, and how much pain medication will I require? And again, that's very variable depending on each patient. Some patients, in truth, do not take narcotic pain medication, and this is probably the best case scenario. If you can take Tylenol or Motrin, that's the most favorable thing that we can have. But of course, definitely if you have extra pain, we do provide narcotic pain medications for a short period of time, usually for about 2 weeks in the immediate post-op time. Another frequent question that I get is how long will my recovery be and will I need therapy? This is also something that depends on the patient. I definitely have patients that do require a significant amount of occupational therapy. I would say on average, a patient will need about 3 weeks or 4 weeks maybe of occupational therapy after surgery. There, of course, are some patients that are doing so well after surgery that they definitely do not need therapy and they never see a therapist. So my recommendation is about 3 to 4 weeks of therapy after surgery, and if you're doing extremely well, you don't need any. Another commonly asked question is what problem can I expect, or what problems can I expect after carpal tunnel surgery? And of course, this can be a long list, it can be a varied list, but there's some common things that patients run into that I'll describe. After surgery, you can still have some numbness and tingling. Immediately after surgery, this can be related to the local anesthetic that was used during surgery. But if you have more severe carpal tunnel, if we've discussed this in the office, your numbness and tingling can take several months to improve. Also, some soreness in the palm, which we call pillar pain. It can be something that lingers, and that's highly variable. It doesn't happen all the time, but it does happen. Another thing that can happen after surgery that's more common is that some people form a significant amount of scar in the carpal tunnel, and that's one of the reasons why continuing occupational therapy helps, because it softens the scar. They do a lot of scar mobility, and if this develops as a problem, it can definitely be handled. In summary, I've gone over some of the salient features regarding carpal tunnel, the surgery, and what to expect after surgery. These are really the common things that occur. Ultimately, carpal tunnel is a very straightforward procedure. It's one of the most common procedures that we do here at OAK Orthopedics. If you have any further questions, or if you have this problem and would like it handled, please do not hesitate to call us at OAK Orthopedics, 815-928-8050, and I'm Dr. Kermit Muhammad.